If you're dealing with an enlarged prostate, benign prostatic hyperplasia or BPH, beware. Some everyday foods could be making things worse. These foods can ramp up inflammation, disrupt hormone balance, and even intensify those frustrating urinary symptoms. In this video, we're diving into the everyday foods you should avoid if you have an enlarged prostate. Dr. Berg recommends that men with an enlarged prostate avoid dairy, vegetable oils high in omega-6, like soy, corn, and canola, sugar, refined carbs, and excessive red meat. These foods can increase inflammation and contribute to prostate swelling, so limiting them may help improve prostate health and reduce symptoms. Before we dive into this video, don't miss my other video, Shrink Enlarged Prostate with this one vitamin. It's packed with valuable insights. Let's get started. Stick around until the end because the top food on our list is sure to shock you. 7. Spicy foods. Consuming spicy foods, such as hot peppers and spicy sauces, can irritate the urinary tract. How it affects the body. Spicy foods can aggravate BPH symptoms by irritating the bladder and prostate. Capsaicin, the compound responsible for heat in peppers, can increase inflammation in sensitive areas, worsening pain and urinary urgency. 6. Caffeinated drinks like coffee, tea, and soda can irritate the bladder, increasing urinary urgency and frequency. How it affects the body. Caffeine acts as a diuretic, stimulating urine production, which can aggravate frequent urination, a common symptom of BPH. It may also irritate the bladder lining, leading to heightened urgency. Some studies suggest that coffee may lower the risk of lethal prostate cancer. The Harvard Health Professionals follow-up study found a 60% risk reduction for men who drank 6 or more cups daily, and a meta-analysis showed a 1% decrease in risk per additional cup. This protective effect is attributed to non-caffeine compounds in coffee, including phytochemicals with anti-inflammatory and antioxidant effects, diterpenes, cafestol and caweol, which may inhibit cancer growth, and chlorogenic acid, which reduces cancer-linked DNA methylation. After watching this video, be sure to check out my other videos. Prevent frequent urination with these 10 foods, Dr. Barbara O'Neill, and Top 7 Herbal Teas to Prevent Frequent Urination, Do's and Don'ts, for even more helpful insights. You'll find the links in the description. Now let's move towards the next food in the rank list. 5. Dairy products. Having dairy products like milk and cheese can worsen prostate symptoms by disrupting hormone balance and promoting inflammation. How it affects the body. Dairy is high in estrogen, which can lower testosterone levels and exacerbate prostate enlargement. Excessive dairy intake can also increase IGF-1, encouraging cell growth in the prostate. High-fat dairy has been associated with elevated levels of C-peptide, which may be linked to more aggressive prostate cancer. A 2016 study by Liu and his team found that consuming whole milk might correlate with a higher mortality rate from prostate cancer. 4. Salt. High-sodium foods like processed snacks, canned soups, and fast foods can lead to water retention and worsen urinary symptoms. How it affects the body. Excess salt intake can increase the risk and symptoms of an enlarged prostate in several ways. 1. Urinary system strain. High salt levels put extra stress on the urinary system, potentially increasing the risk of an enlarged prostate. 2. Inflammation. Salt can cause systemic inflammation, which may contribute to the development or worsening of BPH. 3. Fluid retention. Lowering salt intake can help reduce fluid retention, easing bladder pressure and relieving symptoms. 4. Urinary tract infections, UTIs. High salt intake is linked to a higher chance of UTIs, which can contribute to prostatitis. To reduce your risk, avoid high-sodium foods like pickled vegetables, salted soybeans, sausages, ham, and processed meats. Research on rats has shown that low to high-salt diets can aggravate BPH by promoting inflammation and oxidative stress while reducing protective cellular processes. 3. Red meat. Consuming red meat has been associated with a higher risk of an enlarged prostate, especially in diets high in beef, lamb, and pork. Red meats are packed with saturated fats, which can trigger inflammation and worsen prostate symptoms. A high intake of red meat is linked to elevated levels of insulin-like growth factor, IGF-1, a hormone that can stimulate prostate cell growth, contributing to BPH. How it affects the body. Red meat's saturated fats can increase inflammation, aggravating prostate issues. Red and processed meats contain heme iron and N-nitroso compounds, NOCs, which can damage DNA and heighten cancer risk. Cooking red meat produces compounds like HCAs and PAHs, further linked to cancer. High fat content in red meat also raises estrogen levels, increasing the risk of hormone-related cancers. Additionally, frequent consumption of red and processed meats is linked to higher depression rates, potentially raising prostate cancer risk. 2. Alcohol, especially in large amounts, can worsen prostate symptoms by causing dehydration and bladder irritation. How it affects the body. Alcohol exacerbates symptoms of benign prostatic hyperplasia, BPH, in several ways. Dehydration. Alcohol inhibits vasopressin, a hormone that helps the kidneys retain water, leading to increased and more frequent urination. 3. Inflammation. Alcohol can increase inflammation in the prostate, resulting in more frequent and urgent urination. 4. Acetaldehyde. A toxic byproduct of alcohol metabolism, acetaldehyde may promote carcinogenesis. For those with an enlarged prostate, reducing alcohol intake is advised. 1. Refined sugars and processed foods. Foods high in refined sugars and processed carbs, like candy, soda, and white bread, can promote inflammation and lead to insulin resistance. How it affects the body. Refined sugars negatively impact prostate health in several ways. Inflammation. Sugar increases inflammation, which can cause DNA damage and genetic changes that may lead to prostate cancer. 2. Insulin resistance. High sugar intake can lead to insulin resistance, encouraging cancer cell growth. 3. High blood sugar. Elevated blood sugar can weaken the immune system, reducing its ability to fight off cancer cells. Thanks for watching. For more health-related videos, don't forget to subscribe to my channel.